Congratulations on starting your Invisalign treatment. Today you will be receiving your first 2 sets of aligners. The aligners will be worn for 22 out of 24 hours in the day. It's important to keep this in mind because if the aligners are worn for any less than this, it will result in slower tooth movement and the possibility of longer treatment time. It's important that your aligners are out of your mouth only when you are eating, drinking, brushing, and flossing. Your aligners are sent to us from Invisalign in this box, and inside you will find the complete set of all of your aligners. However, you will only be receiving number 1 and 2 today, and the doctor will indicate how long you need to be wearing each one. Inside each package you will find an upper and a lower aligner, and the package clearly indicates which is number 1 and which is number 2. In case you get the aligners mixed up, it is clearly indicated on the aligner. You'll notice a U printed on it or an L. U for upper, L for lower, as well as the number of aligner that it is. So your first aligner will be printed with 01. So we will be providing you today with 2 cases for your aligners. And inside there is enough room for you to fit both of the aligners as well as a chewy. And that way you can keep one with you at all times. The most common problem we see is that when you take out the aligners to have a meal, you end up wrapping them in a tissue or a Kleenex and somehow they get thrown in the garbage. So if you have a case with you at all times, this gives you a place to keep your aligners, less chance of you losing them. Now in the event that one does break or you do happen to lose it, give us a call at the office and also go to your most recent set of aligners. That will still be relatively close to what your teeth look like now and should still fit you. So you're going to use your most recent set as a backup. So we are going to seat phase aligners. And for the top, I'm just lining it up with her front teeth and just giving it a good push all the way around. Same for the lower. And once you have them in all the way, you're going to use a tool called a chewy. A chewy looks like a piece of rubber. And you basically bite down on it from one end, and you're going to open and close just like Faye's doing. What this is going to do is help to seat the aligner all the way onto your teeth to make sure that it fits properly. And once a day you're going to use this chewy to chew for about 5 minutes. And this is a type of exercise that is for your teeth. It basically helps to improve circulation to the bone and the gums, and this will help your teeth actually move faster. What you can also do is cut a chewy in half, so it looks like a little piece of chewing gum. And Faye's going to demonstrate. You can just pop it in your mouth and chew it throughout the day when you're at work. And you get your 5 minutes of exercise. When you're removing the aligners, you're going to use your fingers and remove from the inside part of the aligner. So with your right hand, you're going to go to the upper left side and grab at the very back. Once you get one end loose, you can pull the entire aligner out. Same for the bottom. Whichever side you want to start with is up to you. You're always going to use the opposite hand to get to the opposite side of your mouth. If you have short fingernails, you might have a hard time getting your aligner out. So we will provide you with this little blue tool, and the edges of them have a hook shape on the end of it, and this is just to help you grab the edge of the aligner. So I'm going to show you on Faye right now. You're going to use it to just hook the inside at the very back, and once you get a good grip, you can pull and remove the rest of the aligner. So once you remove your aligners to have a meal, it's important that you brush and floss your teeth before reinserting them. If there's food trapped between your teeth with your aligner on, this will always increase the chance of cavities throughout your treatment. Now to keep the aligner clean, you're going to use your toothbrush without toothpaste and give it a good scrub. Now toothpaste is very abrasive, and if you're using it to scrub the aligner, you might notice the aligner will start to get scratched and look foggy, and it won't look as shiny and clear when you put it back in your mouth. Also, you're going to use cold water to clean your aligner. You never want to use hot water, as this can possibly cause distortion with the aligner. It can cause it to warp and then it may not fit properly. So cold water is always recommended. You will be taking home today a Sonic Brite unit, and Sonic Brite is a cleaner for your aligners. Batteries are not included, and you're going to use this once a day to keep your aligners extra clean. So inside you're going to place your aligners. There's a fill level, so you're going to follow that. Just add some water to the fill level. And it also comes with a powder cleaner and a teaspoon. So you're going to add a half a teaspoon to the water to create a cleaning solution. Now you only need to leave your aligners in the unit for a few minutes, and the unit will automatically shut off after 15 in case you forget your aligners inside. Once you're done cleaning your aligners, remove them from the solution, give them a really good rinse, and you can put them back in your mouth. So at the beginning, you may experience a lisp with your initial aligners, and this is your tongue adjusting to the new appliance in your mouth. It should improve over time. You may also experience drier lips than usual, so please use lip balm if needed. Soreness of the teeth is also normal. This is part of the process. It means that your teeth are starting to move, and you will probably experience it at the beginning of each aligner. It should last for only a few days and start to decrease as time goes on. You may experience some sores on your tongue, and this is from your tongue adjusting to the aligner. It might start rubbing on certain areas, so if you find if certain edges of the aligners are sharp, you can always use an emery board or nail file to file down any sharp corners. When the aligner comes out of your mouth and you start chewing, you may experience a different bite. Your teeth might feel like they're touching in new areas, and this is also part of the process. So we are changing how your teeth are lined up, but we're also changing how your teeth bite. It's important to keep your scheduled appointments. Delaying any of your visits could possibly lengthen your treatment time in total, but if, for example, you need to cancel an appointment, please continue wearing the aligner until we see you next. Also, if you go to see your dentist for any fillings or restorative work, bring your aligners with you to that appointment. The dentist will ensure that his fillings are going to be custom fitting with your aligners, so this will not interfere with your orthodontic treatment.